So many people don't have much of an idea as to when the right time to see a chiropractor is. Usually my advice to that person, that individual, would be the moment in time when you either have established that you have a problem, that you've realized it in your spine or in your physical body in some way, or you've made a mental choice, or a definitive choice to get a hold of that issue in a practical way. So oftentimes I'll have patients come into my office that have low back pain, and they either experience it acutely, meaning they bent over to pick something up in the shower that morning and felt intense pain, or they've had it from an early age or from a younger age and have realized that it's not going to go away unless they do something about it. So chiropractic care is really helpful for people that want to not just cover up the symptom, not just take a pain medication to make the pain go away, but they're in a frame of mind where they say, I want to get a hold of this and make sure that it doesn't become a future problem, or that it doesn't continue to come back. So what we're really good at here in our office is helping to teach people about why they feel the pain that they do, and helping them to have another one of those light bulb moments where they get to understand, okay, there's a reason behind it. Now how do we approach it in a practical way? Doing treatment in office, teaching people how to live their lives in a way that promotes health, stretches their muscles, helps them to improve the mobility of their spine, so that when they go to do what they're going to do on an average everyday activity, that they're not going to feel susceptible to injury or to more pain. Being proactive is really the key to success.
I would take that one step further. I would say back in 1983, when I first opened my office, my passion was to try to get people to understand that they all have a responsibility in caring for themselves. Chiropractic healthcare is very much like dental care. The goal is to take and try to proactively prevent or not end up just treating pain. Pain is a really great thing because it tells you that there's something wrong, but that's got to motivate you to do something to change it. So back in '83, I started what we call Kids Day. And I started treating kids from the time that they were born. They could be born 2 minutes before they came into the office and all the way up to 14. And my job was once a month, I treated those kids and I gave them the same kind of care that I would give my own kids, in trying to help them develop their spines in a correct way, to not end up treating scoliosis, but preventing scoliosis, for not having pain, but preventing the pain based on understanding that whenever you use a muscle, muscles always shorten. Muscles are attached to bones. Bones go where muscles pull them. Bones don't move into positions without that. Anytime you injure a muscle, the muscle shortens. When the muscle shortens, it pulls the bone. In between bones, you have nerves. Nerves elicit pain. Pain is what brings a patient in the office. So we can get the parents to take and motivate the kids from us giving them exercises, adjusting those kids to make sure an adjustment is something where you position the spine in a way where it's biomechanically correct, so there's not any irritation to the bed of the nervous system. When that isn't there, then the body then doesn't react and respond in a negative way. Kids fall down. We don't want to take and just treat them once they're broken. We don't want just disc disease when you become 20 or 30 years of age. So for 25 years, I had Kids Day. Now my son, Stephen here, Dr. Hill, he now has Kids Day, and he's treating my Kids Day kids as parents, and he's treating their kids. And I have an army of young kids mechanically who are doing an amazing job, because we teach them how to stretch, how to take care of themselves, how to eat right, how to sleep right. It's all a matter of learning how to be a good steward of this body that they have. And if they do the right thing, they do a very, very good job, and we don't end up just treating pain. A lot of people, they think that healthcare, the time to go to chiropractors when you're hurt, that was too late. You don't go to the dentist when your teeth hurt. You go to the dentist to make sure that you're brushing them in the right way. You want to take the plaque off of teeth. We don't want anything to develop in a wrong way. If you always wait till it's a disease and treat a scoliosis, you waited way too long. That's not healthcare. Healthcare is a lifetime. From the moment that you take your first breath to the time you end up going home. I've got 99-year-old patients, and I've got some that still are slimy from being born. And all my kids, I was in the waiting room or in the birthing room, and they all got treated in front of all the doctors and all the nurses. Why? Because I wanted to make sure that the most traumatic thing that the kid went through, which was the birthing process, didn't create a problem. And I have to say, 2 of my kids, they're in their 30s and they've never been on an antibiotic. That takes work. There's a reason why it works that way. And that's what we try to teach all patients, all parents of patients, on how to stay healthy. That's healthcare. Right?
Yeah. I think, with a lot of things in life, it really helps to gain perspective on what's most important. And when we think about healthcare as being an issue that we go to our doctor to address, I think that we've already lost the game if we're in that mindset. Healthcare, it is comprised of the decisions that we make on a daily basis. So if we don't know how to properly care for our spines, and then we down the road get mad at that spine because it is eliciting symptoms, it's eliciting pain, it would behoove us to take a step back and ask ourselves, well, why is that the case? Why are we feeling that pain, and how can we address the issue at its root cause and at its initial basis, rather than dealing with the pain downstream. Something that I tell my patients all the time is that my goal in life as their doctor is to help them avoid future problems, avoid future pain. And the best way to do that is not more of me most of the time. It's more about teaching them how to care for themselves during the time that they're not here in this office. And quite honestly, it's a lot more rewarding as a doctor when that process unfolds and you have patients that brag about not having to come in and see you because of how well they feel. It's a pretty cool thing.
There was one time when I was in front of an audience of about 200 people, and I had people raise their hands. I said, "How many of you have bad backs?" And over half the audience raised their hands. And then I got to say my favorite phrase, and that is, "Let's get it right. None of you have a bad back. You're all really lousy owners. You really don't understand what the heart behind the cry is. The nervous system is telling you that it needs something, just like a baby crying. A mother understands that cry. My job is to get the patient to understand the heart behind the cry. Pain is a wonderful thing if you understand what it means. But if you try to shut it up and turn it off, that's not chiropractic healthcare. Chiropractic healthcare is addressing the cause of the pain, the root cause, and then it becomes beneficial because it's just like if you sat on that thumbtack. If it hurts, take it off. If you got your hand on the burner of a stove, you don't try to grunt through it, you take it off. If you don't do what it needs, then the body will do it in its own way, and it'll pass out and fall on the floor and take your hand off the burner. You have to try to help it address the problem that it's trying to get your attention for. And that's what chiropractic healthcare is all about. Nervous system is something that always takes us to a better place if we don't try to shut it up and we listen to it. And chiropractors are really, really into what the nervous system says. We do not want to take and dumb down what it does, what it says, how it controls. We try to enhance that by taking pressure off of nerve tissue to allow it to express itself and increase overall function in a better way. That's chiropractic healthcare. And that happens from birth till death. It doesn't ever stop. So yeah, pain's a good time to go to a chiropractor, but really you waited too long.
The best way to approach understanding when chiropractic care is most necessary depends on the individual, but for the most part, addressing an issue before it surfaces is usually the most straightforward way to do so. Instead of waiting until pain arises, get checked out by a chiropractor to make sure that you don't have any impending problems that are looming but haven't yet surfaced. I think that's probably the best advice that I could give any prospective patient.